Hi, my name is Ashan Vora. I am a second year fellow currently.
So I'm Hari Gopakumar. I'm a second year Gastroenterology Fellow.
I'm Yashu Reddy, a second year GI Fellow going into third year fellowship.
I'm Shri Puli. I'm one of the advanced endoscopy faculty.
Hi, my name is Daniel Martin, and I am the Assistant Program Director here at the University of Illinois, Peoria.
My name is Sonu Dhillon. I'm the Program Director for the Fellowship Program here at University of Illinois College of Medicine in Peoria. This is one of the youngest and newest programs in fellowship in the state of Illinois, and we feel it's one of the best.
So some of the advantages of the program is we're a very strong clinical program.
The fellows here, we take 3 a year, and the fellows here get a robust experience in a variety of pathologies, both in gastroenterology and hepatology.
So in first year you would be mostly involved at least 50-60% of your time in the GI department you would spend taking care of patients admitted to the hospital.
Here in our program, from an endoscopic standpoint, we do cases from luminal to third space endoscopy.
During your first year, you are mostly on the inpatient service where you're seeing most of the times your inpatient patients, plus you will be doing some procedures, whatever patients you have seen.
The procedural experience here is a robust one, and it is a hands-on one. And so our fellows are routinely a part of each and every exam, not just visually, but hands-on.
If you come to this program, you will learn not only the bread and butter of gastroenterology, but you will see extremely complicated cases of gastroenterology, which is extremely rare in other programs. Besides the bread and butter cases, we do see a lot of comprehensive and complicated patients as well.
From day one, you get to do a lot of cool cases, cool procedures, and when you compare our program with other programs, I think our fellows are exceptionally better when it comes to procedures, which is what motivates me every single day.
Any fellow who rotates through our program gets extensive experience in luminal endoscopies and exposure to third space endoscopy too. From a research standpoint, we do publish 5 to 6 papers every year.
Our program has been very receptive to getting feedback from the fellows and tuning the fellowship to make it or adapting to the recommendations or feedback from the fellows.
You also have a research rotation. During that time, you will have your own dedicated topic on which you can work on.
Finally, we have a very significant research program as well, where fellows are involved in clinical research as well as outcomes research.
If you come to this program, you will turn out to be an excellent gastroenterologist, both from clinical standpoint as well as from procedural standpoint.
So the pathology that we see, or the spectrum of diseases that would fall into the gastroenterology specialty that we see, I think is comprehensive.
By the third year, you will have at least 2,000 to 3,000 cases which you would have done.
We do tons of procedures, not just daily bread and butter cases, but also we get a huge complexity of cases because we're a tertiary referral center.
There's a robust exposure to endoscopy here in our program. Most fellows are graduating with several thousand exams completed.
On a weekly basis, we have cases that range from peroral endoscopic myotomies to transoral fundoplications, removing complex polyps using ESD technique, removing submucosal lesions, to ERCPs, which include altered anatomy ERCPs, endoscopic ultrasound guided treatment of tumors, biopsying of tumors.
In addition to a robust procedural exposure, you also will have great pathology represented on your inpatient rotations as well as your clinic rotations.
So you get a wide variety of exposure in regards to pathology, and also a lot of hands-on exposure in doing procedures, especially because it's a very procedural heavy field. In regards to pathology, I'd say Peoria is like a hidden gem.
I think from an education and endoscopic standpoint, this clinical program offers everything that any other program would.
Peoria has really many restaurants and grown as a city over the last few years. in regards to food, brewery. So even as a social life, I think you have a pretty good opportunities here.
Here you can have Indian food, or whether you want to have Mediterranean food, Mexican food, they have all kind of variety.
When I have some free time, especially on the weekends, I like to go to the farmers market, especially in summers and spring.
There is no such thing called as competition for parking. You will always find parking available. Our program director, Dr. Dillon, is really big on tennis, so he really likes to enjoy in that Peoria Heights area. But staying here, it's very peaceful. There is no hustle and bustle. You can reach anywhere within 15 to 20 minutes of drive.
Life is very quiet and peaceful in Peoria.